Imagine a vibrant discussion between people that includes both openness and critical thought in the pursuit of truth. The Purchasing Truth podcast is an experience, a journey, an exploration of the impact that negative messages in politics and the media have on our families, community, society, and nation. Join your hosts, Bill Stierle and Tom Hazard, to discover new concepts and language strategies that will reveal effective ways of establishing truth. This podcast series will tackle current events, leadership challenges, healthcare confusion, integrity in business, and many other areas that affect us all. Gain clarity and understanding of the various truth perspectives. Welcome to Purchasing Truth.
Welcome back to Purchasing Truth. I'm Tom Hazard, along with your host, Bill Stierle. And, Bill, I really enjoyed our conversation last time about truth in the public servant, but as time goes on, we're seeing this clash between capitalism and health and some other things that really realize that capitalism and truth, being public servant and truth, there's some different things at play here. And I think it's worth taking a deeper dive on.
Yeah, I think so too, Tom. One of the biggest challenges and things I get stuck in my noggin has to do with the need for value. It's a very important, thing for us. It's like, there's value, and mostly in the capitalist mindset is value trickles down to a hard dollar, a hard monetary piece. And that's the thing that becomes really unsettling is that if value is always boiled down to a dollar, then other values are less valuable. Like, I'm just going to name a few: integrity, mutual respect, truth as a value, need for consideration. What does collaboration and cooperation look like in a society? When it comes to the dollar, it's like, well, yeah, those things are nice, but can I make a buck at it? Or will there be a dollar sign at the end of this thing? Because, I did the right thing, but the right thing turned out to be the wrong thing in regards to money. It cost me my job. It cost me my, things. Now, we did have somebody resign to meet their own need for integrity and the need for truth with the infections person, right? And I can't remember his name, but he is the one that stepped into truth and said, we cannot put this message out because it's not in alignment with scientific truth. It's not close on the radar screen. And you're just using this drug or this piece of information as a shill of hope. It's not true. It's the illusion of hope. But you're just using it as a temporary thing that's not truthful, but it will give some people hope because they're on your side and not because it works. And see, this is where where the public servant is standing up for integrity and truth, and capitalism's going like, well, we could promote this for a little while and see if we can get some bucks off of this. It might not work, but there'll be a boost in the stock market. Yeah, it'll go down, but we'll bet on both sides of the up and the down. Notice that you're just shaking your head and just going like, oh man, that's not the kind of truth we want to be shilling and selling to each other.
Yeah, I mean, that kind of stuff happens all the time on Wall Street with betting, whether it's, because there are different commodities, right? I mean, oil goes down, gold goes up, and there are different things like that. But when you're talking about health and safety, that gets murky.
As a bet. Yeah, it is a bet. Yeah, they're betting on health and safety. Yeah, that one's really unsettling. See, the public servant, they're gonna take their punches, right? They're doing things for the greater good, not new to the individuals. Hey, Tom, when you get a ticket for speeding or a parking ticket, it might not meet your need for financial security, but the idea of a speeding ticket is to meet the need for safety and give you a warning about safety. And here is the thing. Now you could make the conspiracy and or true thing that that police officer has 10 tickets to write today. And is that fully true? Well, in some cases, it might be true if they got somebody that is saying, hey, you got to do that, and they're following orders, and all of a sudden you're up and they happen to catch you and you're only 5 miles an hour over and they give you a ticket for that. And you're going like, really? And this is the dance we have between the public servant, in this case a police officer, and capitalism. Hey, I need some money for my police department because we've got to hit our quote unquote quotas. Now, is quoting widespread? Well, I'm not doing the research on that piece, and the answer when it was done was not widespread. It's around. They do look at the numbers. They don't really say it, but people do make mistakes, and you could write them a ticket about that. Now, and is there racial profiling that? Yeah, and that one's also, a partial / stronger truth that is in the environment is that, well, look at the number of tickets and the number of people in jail and that's just upsetting to me. It's so upsetting because it's so not in alignment with truth and integrity. It just isn't.
It's not. And because, to related to what you're saying there, Bill, is there was just yesterday or the day before this jogger who was shot by a black jogger shot by two white men because he wasn't wearing a mask. Do you think they would have shot him if he was a white person jogging, not wearing a mask? I think
Right.
that you can really question that.
Yeah. And here's when the public servant is not allowed to do or not trusted to do their job. See, if a police officer pulls over and says, listen, we have a need for safety. Here's a mask. Could you please wear this while you're jogging? Or even the two white guys pulling up next to him and say, hey, listen, we really want to consider society. Could you jog with this mask for us? Instead of shooting the guy.
Yeah.
That's just a tad bit of extreme to meet the need for health. But see, the anger is being stirred by some people following the rules, some people letting go of the rules, and who's left to be accountable? Two guys driving in a car that are making it up as they go. Do we want to be that kind of society? No, I don't think so. I don't think so. I've seen some of the videos from other countries where the policing is not really particularly great, and people hop out of each other's car and everything from swinging bats to shooting at each other. It's like, oh my gosh, it's like, do we want that level of civil discourse and citizens taking their perception of the rule of law, because the president did say it was optional. I mean, he said the mask was optional.
Well, and he's demonstrating he went to a mask factory and visited it in Arizona and did not wear a mask.
Right. Neither did anybody else in that place, did not wear a mask. In other words, hey, we're okay here because we live in a mask factory, and therefore we're working and we're living and we're making masks. Therefore, just by that extension, it's not, the virus is not going to get on our factory floor. It's so unsettling because that kind of truth, that level of protection, that with integrity is to be demonstrated from the top down. It's not supposed to take away the need for respect for the president, but really actually augment the need for respect for the president.
Right, I agree. I think
any
previous president in this entire country would have worn a mask when they went to the Mayo Clinic, or where is it that Pence went? I don't remember. Mayo Clinic, Cleveland Clinic, somewhere, I forget. And they would have worn a mask, and the president would have worn a mask going to a mask factory or going anywhere right now to set an example
Yeah.
of respect for your fellow citizen and safety. And this president is just, it's all about him, and he's not going to do that. What it's done, what his attitude and what he is, his leadership by his example, is really amplifying the real conflict going on in this country between, freedom and safety, between, choice and
Yes.
protection, right? And I have to say, I'm even hearing it in some of my friends where they are staying home. They have great respect for, the fact that if they want to stay safe and not get this thing, they're going to stay home for a while longer. But at the same time, they're very concerned. They're like, America cannot just shut the economy off for the rest of the year. I mean, people are going to have to get back to work, or we're going to have some much, much bigger problems than the virus. And I think there is some truth to that.
Oh yeah. Yeah. I agree with that. I mean, people's lifestyles, well-beings, financial, outlooks, stability for their home, their family. I mean, even my son and I talked about it this morning a little bit. He goes like, "Hey, Dad, I'm just trying to get through this week." I'm going like, and that's the shrink mindset is I'm trying to get through this week. I'm trying to get through this day, and and here we are. You and I are sitting here. It's actually a Thursday when we're recording this thing, and I've had those moments last week, and I had another one this week. It was Tuesday afternoon again, and I thought it was Friday afternoon. I was going like, I am working my butt off, you know, doing, communication sessions, providing people support to get freedom in their own mind, to be able to take an action, even though the specter of helplessness and hopelessness is sitting on your shoulder. How do you dig yourself out of that? Is you focus on the things that you can and do have choice about. You can and do have choice about. And Viktor Frankl in Man's Search for Meaning said this very important thing. I know I'm shifting over here because it actually has to do with choice and truth. As a psychologist, Jewish psychologist in a Nazi concentration camp, being captive there, he had to focus on what choices do I get to make, and then just make those choices. So his mental state stayed stable. And here were some of the choices. Today, I'm going to choose to get out of my bed with the right foot. And tomorrow, I might choose to get out of my bed at the left foot. Now, if you think about that, it's like, oh my gosh, that is such a small choice. But psychologically, you are actually picking. I'm getting out of my bed. Now, I don't get choices in some of these other things. The death around me, being in a concentration camps, the amount of food I get, whether my number's up tomorrow. I don't get a lot of choices there. But boy, by golly, mentally, I've got this choice. I've got this choice. And then I also get a choice to be kind to the guard. I have a choice to say good morning to others. I have a choice to, there's a lot of choices, but it's very minimalized. Now, for all of those people that are on this, that are listening to us there, that's a part of the practice of meditation and the practice of prayer is making choices about what you're focusing on. Same choices. Now, how it relates to our topic, truth, capitalism, and the public servant, is that we've got to make choices on the public servant side, and we've got to make choices on the capitalist side. What are our public servant pieces? How can we get protection and safety? And then on the other side is how can we get financial security and start back up to have our way of life come back? And I know I threw a whole bunch of stuff at you, Tom, and you're like smiling like a little bit of Cheshire Cat stuff, but it's a daunting thing to like get used to. What is my choice that your friends are talking about? How do I choose safety? How do I choose you know.
Or how do you, and is there a balance, or
Right.
how, and we all need to know need to get back to work, but at the same time, if we do it too soon, I mean, even I think really the decision has been made for us here in many ways, with how many states that are already open or partially open. It's like 40 at least now, or they're either open or starting to open this week. By the end of May, it's going to be too late. We're going to know how bad it's gotten, what the new hot spots are that are not New York City, that more
Yeah.
people are dying, and we're going to have 3,000 deaths per
Yeah.
day. We're going to find out that if the decision to turn the economy back on sooner rather than later was helpful
I
with
feel
health,
I
was
feel
it helpful with the economy? Because people may think we have to get back to work because I got to put food on the table and I can't afford to feed my family, and I totally get that.
I'm going to
But
sacrifice my life to do that.
well, are you going to sacrifice your life or life of some of your family members,
Yeah,
or
many people say no to that. Many
and
people say no.
but the other thing that people don't realize is, many people I think do not realize, is that you turn the economy back on now, temporarily, financially, your situation might be improved, but you might actually end up having to shut things back down again for a longer period of time, that makes the financial pain even worse than it did had you stayed home for another month and not reopened in the first place. So it may be counterproductive, right?
Yes. Yeah. I think the thing that we're going to experience, if I'm taking my best guess, and all of a sudden we can actually start looking at this best guess, is that, okay, there was this peak in New York and it looks like there's some flattening and declining going on. Now, here's what other nations have done. They kept their peak lower, and their flattening was very, when they finally flattened it, it was 10 people, 20 people died, 100 people died today, not 3,000 people died today, but 10, 20. Because of the way we're doing, the flat line is going to be higher. It's going to flatline and stay at 3,000. Then everybody's going to say, see, it's flatlined. But it belongs to be flatlined at 100 a day, not flatlined at 3,000 a day. They will literally, right, their truth will be, the line is flattened, but the line has been flattened too high.
Way, way too high.
That's the narrative that we're going to hear. And it's going to upset you and I for about the next 2 to 3 months.
Oh, at least.
We're going to look at it and go like, hey, remember that episode we did in May? Well, about where the line's going to get flattened, and it is flat. It's going to be flat at 3,000 or 2,000 a day. It's going to be flat there.
Right.
But that's way like too high. It belongs to be at 100.
Oh.
Or 50.
Well, and
10.
The truth that's being purchased right now is now, the White House has clearly changed their approach. The daily coronavirus task force, briefings are fewer. He's even talking about disbanding the task force by Memorial Day, which doesn't make any sense. But what we're hearing is, oh, we've done such a good job. We've saved millions of lives, because the number keeps creeping up of now it's over 70,000, and it's probably going to get to 130 to 150,000 deaths in the US. But millions of
by
lives.
By the end of May, it'll be 100,000 it'll be 100,000 by the end of May. It's already at 75. So it's going to be another 25,000 people are going to die between. So we're going to hit by June 1st, there's 100,000 people.
Easily. But that 100,000 number is much bigger than the White House ever wanted it to be. The president had always, give lower estimates, and we're doing a great job and it's going to stop here. But because it keeps creeping up, now he's got to make that proportional number lower. So he's like, oh, we've saved millions of lives by what we've done. This 100,000 right here, we did a fantastic job, right? That's what he's trying to say.
The biggest challenge with this disease, in truth, is because I read a comparative article about AIDS when the AIDS epidemic went through, and same narrative regarding Reagan not paying attention to it, not really being in action, and it was a sexual transmitted disease, which was very uncomfortable for people to talk about. Who wants to talk about their sexuality openly? Who wants to move into a place of using a condom? Oh, it's hitting the gay community mostly. Well, I really actually don't want to talk about that issue either, because there's a lot of voters that don't like those people and have a belief that it's a disease for them. But once it's in the blood bank, and once your friend Rock Hudson gets it, then all of a sudden you do something about it. And that's really kind of the way the timeline took place, is that it's like we got to work on the public health piece, not vote as if this public health piece has that strong of a financial piece to it. Yes, it has a financial consideration to it, but not when the public good is looking for the government and the various different agencies to protect them. We, as human beings, are extending trust to them to take care of some big things so we don't have to think about those big things. That's what we're doing. So the dance between capitalism and the public servant, capitalism and socialism. Well, the public servant is a socialistic job. I mean, when you vote for your representative, your salary is paid by everyone in that state. That is a socialistic move, is what that is. Now, are some things better as capitalism and some things better as socialism? Yeah, there actually are some ways to actually have an honest discussion about that. But when we're looking to transition and have an honest discussion about what the value of life is, who is expendable? Well, in the 80s, AIDS victims were expendable because it was people not in a monogamous relationship, and most certainly gay people that were not in a monogamous relationship, as if that was right in their viewpoint. And then, do old people really have a value in our economy? And as I allow that to drop, all of a sudden you can see how unsettling it becomes. Well, Tom, I don't know. Do you think old people have a value in our economy?
Oh my gosh. Do I have to answer that question? Holy mackerel. Of course they have a value. Oh my goodness.
Yeah. And how do we honor and respect them, to have a full life, or as full of life as they can, or a full of life until their last breath, whenever that is. And our medical system is set up to keep them alive as long as possible, because we don't have a graceful exit plan. We have, hey, when your body falls apart, or when there's a disease that's big enough that they can take you out, that's when your number is up. And in this case, we're not protecting them. And all the people that fought in World War II that are in that age group, they are seeing what we're doing for them. We are not protecting them the way we need to.
Not at all. But
So
the reality, and it is so hard. I mean, there's even the reality that it's very hard to protect anyone from this virus. It
Right.
came out in
It
news
is.
today that one of the president's valets, and he has military people that tend to him all the
Sure.
time, always does, right? And maybe carry his bags to the helicopter, and they tend to him personally, interacts with them a lot. One of them tested positive for coronavirus yesterday. And so, apparently this was like an oh shit moment in the White House that, was like, how could that happen? Well, guess what, people? This virus is pretty damn hard to stop.
It is very hard to stop.
And you wonder if something like that has to come home to reach the president, or if he actually ends up testing positive, will then his perspective change,
Right.
and only after it affects him, because this president, if nothing else, is all about me, meaning him.
Correct. Yeah. Yeah.
Because they're and that's unfortunately, though, there is this significant lack of leadership on these issues of economy versus health, right? And it's created, and the president has, I think, fanned the flames of this culture war in the United
Yeah.
States we have over masks right now. Don't you
Yeah.
agree? He really
That's a
has.
good, that one is really, really tough. And the tough part of it is he's playing both sides of it. So his supporters are actually on both sides. So his supporters are on both sides. Some of them going like, well, hell no, I'm not wearing a mask. And anybody that asks me to wear a mask, I'm going to act my freedom and my choice to do whatever I need to. And I think you had a story about the bus driver or something, right? Isn't
Yeah,
that
yeah.
right?
This just came out that there were the day we're recording this, that there was a bus driver a woman bus driver who had a passenger gets boards the bus and is not wearing a mask, and the bus driver lets them know, hey, you need to wear a mask, and this passenger responds by spitting on the bus driver. And I'm just like, wow, is that, like you mentioned about our level of discourse in the United States,
That's
is
right.
that where
That's right.
we've devolved to? I
Yeah.
mean,
We don't
that it's
respect each other. Hmm.
horrible disrespect, number one. Number
Yes.
two is, you know, the person who does the spitting, not only is they disrespecting them, the bus driver, but they're also potentially causing the very harm that a mask is supposed to protect. I mean, it's despicable. And I mean, to me, the fact
Well,
that there's no national
respect. Yeah.
leadership and no standard for not only wearing masks or not, but then also what the consequences are. I mean, I'm sure there's not a law on the books about wearing a mask or not wearing a mask, but maybe there is about spitting on people. I don't know. But to me, there has to be some consequence for that kind of action.
Yeah, protection. You're looking for the consequence to protection to remind the person, similar to a speeding ticket, to remind the person that this is what safety looks like. Safety looks like wearing a mask, and safety looks like not spitting on people. Or if you want to exercise your need for choice, walk. Just walk. You don't want to wear a mask? Great. Walk. Stay 6 feet away from people. Oh, you don't believe that the virus is things? You think it's either a manufacturer, it's a conspiracy, you're buying into denialism, you're buying into a belief structure that validates that you get to spit at others and that's okay. Again, listen, spit on the street if you want, but not here, not
Well,
on
and
someone, not in
and
this space.
this was in your former state. This was in Miami-Dade County, Florida. This occurred, and
Wow, okay.
and actually, it just made the news for some reason. But apparently, this
Sure.
happened in the third week of April.
Okay, so a
So
few weeks back,
a few
but it's
weeks
still
back.
there. Hmm.
Yeah, yeah. It
Yep.
just made the
Yeah,
news,
full
and we
weeks back.
became aware of it.
That one's tough. That one was really tough. And there's the other one that happened, the jogger that didn't wear the mask that got shot too, which is has a similar narrative that, hey, wait a minute, you're not wearing a mask. I am going to take an action because there's no police officer that's going to pull you over and say, here, buddy, wear a mask. And I'm not going to be the civil servant pulling over and say, hey, listen, would you be willing to consider others by wearing a mask and hand the guy the mask? But no, they think that they need to be the person in charge of being punitive,
Well, and
which is not.
the thing that's really surprising about that one, about the jogger, is that jogging, I see joggers all the time. I mean, I live you and I both live in Southern California. I don't know how much you get out, but I get out walking my dog every day, and I'm not
Right.
wearing a mask when I'm walking my dog throughout the neighborhood. And maybe we walk a half a mile or a mile at times, but it's not not a tremendously long
Very
distance.
spacious community, a lot of fresh air, a lot of sunlight, a lot of heat, a lot of things that would minimalize your particles carrying something to someone else.
Well, and
So
also there's
you
ample
make the
opportunity
choice.
to stay far away from other people. And even when I do
Correct.
encounter other people walking, jogging for their health, if I'm there with the dog
Consideration.
on the leash,
Mhm.
then a jogger who's coming on the same sidewalk toward me will usually go out into the street with a distance of a whole vehicle in
Totally.
between us at least, and we don't come near each other. I think it's very reasonable that joggers have awareness for what's coming up ahead of them and to take the appropriate action to minimize exposure. And so jogging, to me, that whole incident was not just about a mask. It was there's other things that must have come into play
It
there.
seems like that there was a race piece to it, if I'm thinking about it right, as well as, I mean,
I agree. I think
uh
there was.
there's been a lot of years that has been spent um cultivating the belief around race being dangerous. There is, it's like other than white is more dangerous than other human beings, and the numbers are clearly not in alignment with that.
Right.
So um so the truth is totally lost on this one. It's like somebody also posted this one on Facebook, which is, kind of a worthy note. If all of the people that were, protesting with guns in Michigan, if you change all their faces to either black or brown, there would be a very, very different response,
A very
rather
different
than
response.
about a bunch of white people expressing their need to be heard. Meanwhile, it's like, well, you guys have a need to be heard, but not if you have guns on, because you're violent people, and this is, therefore, you have more of the potential to be violent. And the answer is, no, I don't. I mean,
Well,
your group is just as violent as my group is.
and another interesting meme that I happened to see related to that same thing with the people who, who made their way into the Capitol in Lansing, Michigan, with those guns, was uh, telling them that what was I guess poking fun at those protesters by in like Photoshop digitally replacing the rifles, the guns. Did you see this? The guns that they're each holding with each an inflatable penis. I mean, it was
Oh boy.
hilarious, but as if they're just needing to, try
That's a
to.
self-worth, a respect, that I am showing some strength,
Right.
which is, many times
And I'm
men do
carrying a
that thing.
gun and I have power because of it, and am
Yes.
worthy of respect because of it, and all the sort of stuff. And really the meme was trying to say these guys are kind of being, childish in many ways.
Well, the need for respect is, something that, human beings really put a lot of energy around. Self-worth, they put a lot of energy around my identity. I want to be known as this type of person versus this type of person. My beliefs are so strong that I actually can hate this other kind of person because my identity says that, I hate this other person. Now, you can ask any college, not any, but many college alumni, who is your college rival? Oh, we do not like those people. And from that college, they're our rival. I'm sure that Michigan and Michigan State have a thing or two to say about that, and
Yes.
just, Notre Dame and have your pick, and, I mean, it's like,
Well,
it's that
it's
adversarial,
yeah, it's UCLA and USC. There's always this,
right?
thing between them.
Right. And what is the thing? Loyalty. identity, need for respect, who's going to win this time, something to invest our emotions in. Where am I going to yell and scream yet at this game? Why? Because I did it for 4 years in college and 2 years in graduate school. I yelled at this other team. So I'm going to the game and I'm going to donate to my school. And, next year we're going to beat USC, whatever.
Right.
Right. So I think that, one of the things that we can really, kind of pull off of our session today is really for us to internally start asking the value of life, double ask ourselves a better question around who is expendable and what is this expendable energy really about? Is it, what is the value that we are standing for as human beings? And then, when we take a look at the culture war regarding fit masks, it's got to be centered around consideration that I might not have the same belief structure as another person. And because of that, I can wear a mask. So we all feel better in the same community. Because if half the people are wearing the masks, now watch how weird this is, and the other half of people are not wearing the masks, the people that are wearing the masks will go to another store. It is an economic reason. They're saying open back up again. That means you want people to purchase things. Well, guess what? Half of the country has been terrified because of the lack of testing and the lack of contact tracing. That is a public servant failure, straight out.
I agree. It is.
And it has impacted capitalism. And it will continue to impact capitalism for the next 3 months. Minimum.
You're right. It will. And the bus is a different scenario because people have to be in very close proximity than the jogger when we were talking about that. But retail stores, you can't help but get so close to people. And each store is making their own rules.
Consideration. Right? Yeah, yep. Everybody's leaning on their own rules. So that brings up another situation. We could definitely talk about the rules and truth here, because, hey, people make the rules. I make the rule for my kids and they break them. I have a good conversation with them about the good reason why the rule's there, but it still doesn't mean they are not exercising choice. And that's the thing to kind of like to take off. So wow. Good one today, Tom. We actually did something here.
We did. And, lots of other, I think, spin-off topics to cover as we go forward for sure.
That's right. Especially political when Biden gets involved. He's got to communicate truth and the balance of truth. He's going to get further with that. And then take on the polarization and the distraction energy that's there. So, well, more to come on this.
Okay, Bill, thanks so much.
Thanks, everybody.
Thank you for listening to this Purchasing Truth podcast. We trust that you have enjoyed this engaging and thought-provoking conversation. Our hope is that you've received value, found clarity, and broadened your truth perspective in this episode. If you did, leave us a review or visit our website, purchasingtruth.com. Join us again for another informative and content-rich discussion here at the Purchasing Truth podcast. Don't just accept whatever information comes your way. Join the discussion. Discover your own voice. Purchase your own truth.